Hi, this is Nancy with the Hospice Care Plan, and my patient is Brenda today, and I'm going to show you how to place a bedpan. We use, of course, what's called a fracture pan. It's very narrow, you can see, and it's much more comfortable than the old-fashioned bedpans that aren't used anymore. So this video is not about positioning anybody. Brenda is pretty able to move in bed, so we're just going to know that she's helping me during this positioning. So she tells me she has to have a bowel movement and she wants the bedpan. I'm going to get her onto her side. And of course, I've already pulled down her pants or gotten rid of any kind of pajamas that she had. So she is now completely nude from the bottom, her waist down. You place the bedpan not with the thick part up on the back. That would be very painful. You want to turn it so that you're going to just gently push it so that it's in the center of her bottom. And know that when you turn her, you hold it so that as she turns back onto it, it stays underneath her. So I'm going to ask Brenda I'm going to gently bring her back. And I'm going to maybe even check between her legs to see if that's in the right position. It is. I tell her, time to let it go, honey.
Give some privacy. Also, using some cornstarch or baby powder along the edge of the bedpan is very helpful to make it more comfortable, slides easy, and don't leave anybody on it for long.
Yes, don't leave it very long. It's very uncomfortable. So you're going to stay with them or at least set an alarm so that you're back within 3 to 4 minutes. Okay, let's say Brenda has finished. Again, I'm going to slide my hand gently under to grab that pan so that as I help her turn off of it, it doesn't spill. Okay? And then, of course, I will have all of my cleaning supplies available. I will clean her appropriately and then take this away after I'm sure that she's been cared for. Now, you know, we do have bedpans available, but you know, most of people these days and in hospitals, we are using oftentimes absorbent briefs, and the patient will defecate directly into this. Let's say you had to give someone a suppository, and so again, you're going to want them in the same side-lying position, knowing that it may take a little longer. So I'm going to position Brenda onto her side, knowing that she's going to be there for a while because the suppository, once it's been placed, needs to melt. I'm going to make sure she's comfortable. I'm going to put a pillow behind her back. If I had another one, I might give her one to hug onto on that side. And now I've inserted the suppository, and guess what? One of the best things to do is if you have a plain absorbent pad, I would use that. I don't have one right now, so I'm going to use a brief, and I'm just going to tuck that under her bum right there. I'm going to cover her body with a nice sheet so that she is not cold during this process and allow for space around her rectum and her buttocks. When she actually defecates, the stool will go directly onto that pad, and now all I have to do is go ahead and clean her and then pull it away, discard it, and put a clean one on so that she is now clean and fresh. So that's how we use a bedpan or an absorbent pad.
And oftentimes we find that a bedpan isn't as useful as just going on their side and using bed pads. So please get a copy of our booklet, The Hospice Care Plan. You can find us at thehospicecareplan.com and our YouTube site, The Hospice Care Plan.